On Your Side Mirror this morning, we are creating a sustainable support system for breastfeeding in Nigeria. And joining me in the studios this morning, I have Dr. Emmanuel Ogbe, who is a consultant pediatrics with RJOLAD Hospital. And this morning, we're going to be talking a whole lot about the support systems for breastfeeding. Dr. Ogbe, nice to have you in the building. Good morning.
Yeah, good morning. Thank you for having me.
All right. We always say that breast milk is much more than food. It's a baby's first vaccine and also first protection and first love too. But Dr. Ogbe, from what you see, are women or perhaps generally parents, are we seeing breast milk as that to our babies?
Yeah, thank you for that question. Well, to say the fact, a lot of people see it that way, but then despite that, the rate of breastfeeding in Lagos and Nigeria as a whole is not very encouraging.
It's not very encouraging.
Yeah.
So put a kind of figures to it. So out of 10 women, how many of them will do exclusive breastfeeding for 6 months? Out of 10. If you have 10 women in this room, how many will do that?
Yeah, we're talking about maybe 2 to 3.
Wow, that's low.
Yeah, it can be that low, really.
But breastfeeding, I thought it was very common. That's perhaps the most common way of feeding our children, our babies.
Yeah, it is the safest and the best way to feed babies. Yeah, but for certain reasons, some of which we may encounter during this
because of the program.
Yeah, somehow where mothers are not doing enough of the support.
Wow. Women, this is not pleasant news. You deserve to be flogged if that's the case. But talk to me, what are the benefits of, ensuring that our babies are well fed with breast milk? Talk to me.
Yeah, numerous, really, very, very numerous. To start with, breast milk is the optimal nutrition for, the newborn. When we say optimal, it contains the right amount of nutrients and in the right proportion for the newborn. So the best food for the baby that is born new is the breast milk. And aside it being nutritious, it also helps in many aspects of their growth. And the newborn period is a period of rapid growth.
Okay.
And the breastfeed is fashioned and designed to match up the requirement that is needed for that baby to grow healthy.
Right.
Added to that is the aspect of the immunity. I'm glad one of your opening statements is the fact that breast milk is the baby's first vaccine, like you rightly said. Yeah, so it helps to protect the child from numerous diseases. Common to mention will be pneumonia, for instance. All right, and aside the baby, the mother is also protected. Studies have shown that mothers that breastfeed well tend to have less incidents of cancers that affect women, like breast cancer, cervical cancer. Somehow there's a link with effective breastfeeding.
Wow.
And reduction in that.
So women that breastfeed their children properly are less likely to contract breast cancer.
For instance.
Wow.
Yeah, it's less likely.
This is good news.
Yeah, really.
So if that's the case, I feel women should be embracing all of this.
Yeah.
Okay.
Yeah.
And I also understand there's the emotional bonding support that it brings to.
Yeah, exactly. I was about to mention that. Yeah, it's the breastfeeding moment is a time for the mother to get bonded to her baby, and that's one thing that breastfeeding will help her do. And that bonding period helps a lot in the overall emotional build-up.
Right.
Child going into the future.
All right. So, Dr. Emmanuel, well said that these are real benefits. But, 2 to 3 women would, out of 10, would do exclusive breastfeeding. Maybe others might just do like maybe 3 months or thereabout, and then they go back to work. But what are the barriers? What are the barriers that women face trying to breastfeed their children?
Yeah, quite a number, really. Ranging from cultural practices to misconceptions, and then to also societal factors that stand as barrier from women achieving this. I start with the myths or misunderstanding about breast milk. For instance, some people believe that breastfeeding is painful. So because of that, they tend to be averse towards breastfeeding. And the truth of it is, the less you breastfeed the baby, the more likely the pain, because the breast will get engorged, and then can get infected and cause pain.
Yeah, but doctor, is it really painful?
Yeah, well,
I would have thought it would be delightful, not painful.
To be honest, well, maybe at the if the technique, if the baby's mouth is not well positioned, into the way it should be on the nipple, that can cause a little pain, discomfort to the mother.
Okay.
But that is just transient, just minimal pain, if at all any.
Okay.
Yeah. So another barrier will also.
It's good you're speaking to the microphone very well now.
Yeah. Another barrier will also be, another misunderstanding is that babies that are breastfed need water, especially during hot weather. That is actually also a misconception, in that the majority of breast milk is water. If you understand, like almost up to 80 to 90% of breast milk, as it were, is water. So there's no need for extra water for babies that are breastfed, that have been breastfed.
Okay.
And then also some have this misconception that small breasts don't produce enough milk.
Is that true?
Yeah, well, that is not completely true. That is not true. Yeah, really, there's no relationship between the size of the breast and the milk. The truth is, the more the mother breastfeeds, the more the milk comes. Like a demand and supply thing. The more you breastfeed, the more the milk comes.
Wow.
It's more a function of frequency of breastfeeding than of the size.
Okay.
Yeah. So those are a few of the misconceptions, right?
What about those that have the feeling that, well, if they breastfeed the baby too much, their breast will likely go sagging?
Yeah, that's another.
It's a misconception.
Misconception, really. Yeah, there are more factors that influence sagging of the breast than really the act of breastfeeding. For instance, the age of the mother, for instance, is a more stronger factor, and then the genetic makeup of the individual. Those are factors that play a far greater role in sagging than breastfeeding. You can see typical example is the nuns that don't breastfeed at all. They never get pregnant to start with, and still the breast sags. So
there's no correlation.
It's not really a function of feeding, as it were,
right,
but more of the genetic makeup and the age and probably other related factors.
Okay, so but doctor, I mean, a woman will have a feeling, this is my own breast, and I choose to do what I like with it. If I feel like feeding or breastfeeding the child for 3 months, so be it, or perhaps 5 months or 4 months. Why must it compulsorily be 6 months?
Well, I wouldn't want to look at it as compulsory. It's a recommendation, right? And this recommendation didn't just come out of the blues. It's based on studies that have gone into it and have proven that if a mother give baby breast milk only for the first 6 months of life, as recommended by the World Health Organization, they tend to get all of these benefits that we have mentioned, that we highlighted earlier. So it's not as if it's compulsory, but it's what is recommended, and it's what we tend to preach based on studies that we have.
All right.
Yeah.
So let's look at the sustainable support system that can be put in place. How can we build this kind of sustainable support systems for breastfeeding?
Yeah, thank you very much. We can look at it at different stratas. We'll start with the immediate environment, which is the family. Everybody needs to be involved when it comes to breastfeeding, starting from the spouse, the husband in this case, and then the other relatives like the mother-in-laws and the like, right?
Okay.
We need to know that it's a very important stage, and the mother needs all the help that she requires at this stage. Many times it's a new mom that is not well knowledgeable, so the older moms that are there need to put her through in terms of how to well position the baby, and then in terms of other support, the mother needs a lot of rest at this stage to be able to produce milk well, and because of the way the baby is conditioned, sometimes it is when the mother wants to rest that the baby starts crying, and that on its own can affect the mother psychologically and also reduce the quantity of milk that the mother produces. So at that times like that, she should have people that will take care of the baby while she sleeps, and she can actually express breast milk, and that can be fed to baby during that time when she needs that very much important rest.
All right. I'm sure, doctor, you must have heard this. That sometimes you just have babies who just refuse to take the milk, or perhaps who are not able to suck and get enough milk. So what would you say in that kind of a situation?
Yeah, hardly will a baby refuse to take the milk. Yeah, if a healthy baby will naturally, will want to feed. Feeding is like a compulsory thing in life for like babies, right? So if a baby is not tolerating them, there may be some things that we need to look at. First of all, look at is the baby comfortable? From the way the mother is positioning the baby. Sometimes if you position the baby such a way that the neck is not well positioned, is not well aligned with and comfortable, the child will want to seek for comfort. And then sometimes there could be a little blockage in the nose of the child, and naturally, because they don't know how to breathe with their mouth, they breathe essentially with the nostrils. So if there's there's a little blockade, they want to prefer to breathe than to feed, So they, at that point, that can make they seem as if they're averse to the feed.
And that's where the advice of those who have bigger boobs must come to play. Maybe they should be taught on how they can handle the baby with that, right?
Exactly.
All right, some reactions are coming in here for you. Doctor, this one says, good morning, doctor. Is it true that exclusive breastfeeding makes a baby smarter in the long run? You didn't put your name, but thank you so much. Is that true, doctor?
Yeah, I think it's a very good concept in that breast milk has a lot of things that makes for healthy brain development, and of course you need a healthy brain to be smart, isn't it?
All right.
Yeah. So eventually, if you breastfeed well, the baby's brain will develop more properly, and eventually it can affect the child's smartness.
All right. Maybe somebody is reacting to what you said. This one says, good morning, sir. Please, why is it that my baby is refusing to breastfeed even when his mother is producing enough milk? Mr. Juwon from K2 is sending that one in. Juwon, thank you so much.
Yeah.
Doctor?
Okay, yeah. So thank you, Mr. Juwon, for that question. Yeah, we need to have a closer look at that baby, and to be sure there are no underlying things that we need to address. And that baby will want to feed. But in the event there are one or two things that maybe we need to address. Look at the child's general health to start with. Are there any health issues? Are there other approach or practices that we need to address? We look at these are things we do very well at our clinics at RJOLAD Hospital.
So let's come to RJOLAD now, because I'm just about bringing that in. So what's the RJOLAD recipe for support systems that could make women breastfeed properly?
Yes, thank you very much. At RJOLAD Hospital, we have a very robust antenatal clinic. So we try to approach it right from the time the mother receives the good news of her pregnancy. We encourage them to, register on time for antenatal, and we have classes with specialists, lactation specialists that will give mothers information what to expect and how to approach feeding, and the strategies that they will adopt, for a successful feeding. And in the event that the child is born, one of the things we do during our routine newborn check, we look at the child from head to toe after baby is born to ascertain the readiness for feeding, and we encourage as much as possible, the feeding process, and we'll guide the mothers through when they come for our clinic, by continuing, giving them the right information, and disabusing and removing from their mind those misconceptions that they may have had before.
More reactions coming in here for you, Dr. Emmanuel Ogbe. This one says, good morning. Some women feel embarrassed breastfeeding in public. How do we make society more supportive? You didn't put your name, but thank you so much. That's a source of concern for especially young women. Dr. Emmanuel.
Yes.
I mean, the baby is crying and she's in public. She's just wondering, how am I going to open up right now and breastfeed my child?
Yeah. So, thank you very much for that question. Yeah, it's really a source of concern for many mothers. And I think the society needs to come to that understanding that, breastfeeding is a special period.
So how should you approach it at that point of period? What should we tell the lady?
Yeah, well, she should also bear in her consciousness that, it's a necessary duty and must be performed. There are some approaches that some mothers have tend to adopt, there are special bras that will, expose just minimal part
of the nipple.
And that is sufficient for breastfeeding. And some use like a covering, maybe a towel or something.
Right.
That can make them comfortable. Yeah.
Or women can hang around them, just provide a kind of shield.
Yeah, that's another thing we can do too. Yeah.
All right. This one says, "Good morning, Traffic Radio." He said, "Good morning, Traffic Radio family. I am an expectant mother, and this is my first child. Please, is it true that babies who are breastfed fall sick less often than those fed with formulas?" Kike Lomo is sending this one. Kike Lomo, thank you so much. So, maybe you need to help Kike Lomo.
Yeah, thank you very much, and congratulations, Kike Lomo. And I wish you a safe delivery. Again, a nice question you've asked, really. Yes, if your baby breastfeed very often, there are some part of your defense system that you transfer to the baby through your breast milk, and that can make the baby, more resistant towards infection. Yeah, it's a true statement. Okay. That if you breastfeed well and do it good, the baby is less likely to fall sick.
Right. All right. So, RJOLAD, you said you got to have enough systems in place?
Yes, exactly.
All right.
Yeah. So, a robust antenatal system, and then we also have pediatric clinics that runs every day of the week from Monday, to Friday. All of these are available to help guide our mothers and their babies too.
And where are you guys located?
Yeah, we are located in many locations. In our main branches at Bagada, RJOLAD Bagada. We also have the RJOLAD at Kupa, and then we also have RJOLAD at Gege. Yeah, and then we also have many other spokes that are linked to the main RJOLAD Hospital.
All right. Yeah. As we run this off right now, Doctor, what's your message to our people? What's the advice?
Yeah, breast milk is very, very important to the healthy growth of the baby, and it's not the responsibility of the mother alone. We all need to play our parts, right, for that, ranging from the family, immediate family, then to the society at large, in order to help mothers achieve this very important goal.
All right, we'll leave it at that for now. It's nice having you in the studios. Thank you so much for connecting with us this morning.
Thank you for having me.
All right, we've been trying to see how we can create sustainable support systems for breastfeeding in Nigeria. And we've done that from the perspective of RJOLAD Hospital. Dr. Emmanuel Ogbe is consultant pediatrics with that particular hospital. A brief break. We do our birthdays, and when we return, of course, we switch over to TRCN.